Here's today's MercyOne Genesis Medical Moments.
We are continuing our conversation with Tara Erpelding, Director of Oncology, about personalized and local care for cancer patients. So, Tara, how do you work with local doctors and even specialists to make sure patients continue to receive proper care during, even after cancer treatment?
So that relationship is really important because oftentimes the first time a patient has any sort of symptoms, they go to their primary care doctor. So they're the first line with cancer treatment. And at MercyOne Genesis, our physicians are very well connected and very close. And oftentimes if there's a question of, does this look suspicious? Does this seem out of the ordinary to you? The physicians will just pick up the phone and call each other. There's a lot of trust there. It streamlines many processes. You know, a lot of times you'll hear people have to wait a long time for imaging or different parts of the process. And I think coming here in this community setting, it is a very tight-knit, connected group. So it's nice. So even when a patient's finished with their cancer care, when they come in for their 6-month appointments or different things like that, if the doctor notices, the oncologist notices something specific, they can actually call the family practice doctor and share vice versa. So yeah, very good teamwork.
Now, is there a story that stands out to you about how personalized treatment made a difference for families or even a patient?
Yeah, I actually have my own story. So my daughter passed away from cancer 2.5 years ago. She had bone cancer, and we had to get her treatment, being in peds, we had to get her treatment outside of the area. And as we went through our journey with her, we realized, you know, midway through, we don't necessarily have to drive 5 hours away to get her treatment. We don't have to go an hour down the road to get a blood transfusion because it was so hard on her. So I personally have lived the journey of it is very important and crucial for patients to be able to utilize the resources they have at home. And we have awesome resources here. So it's kind of my personal message to make sure people know you can do it here. Ask questions, ask your oncologist questions, your nurse navigator questions. What can I do here and what should I go away for? And they'll tell you and help you out with that.
No need to drive 5 hours,
No
right?
need to drive 5 hours, no. And so many people do that, I think, because we all have it in our head. We're going to get the best care if we go to this place, or we're going to get the best care if we go to this place. And while they're all amazing facilities, you don't have to do that when you get the same medicine or you get a blood transfusion. All of that can be done right here, and you get home in 10 minutes and can sleep.
Right.
You know, I mean, we lost a lot of time in car rides with our daughter, and I'm super passionate. We didn't have to do that. So I want everybody to know who has cancer, come here and get some quality time back.
Yeah. For sure. What a great message to spread. We're seeing a lot more personalized medicine with patients. How's genetic profiling changing how you decide on treatments at your clinic?
Genetics is a huge part of oncology now. So there are a lot of different cancers that have genetic markers. Breast cancer, I think everybody has heard of the BRCA gene and how you have to watch that, but there's also ovarian, pancreatic cancer, colorectal cancer. Many of the cancers you've heard of do have a genetic link, so it's nice. We have a really great genetics clinic at MercyOne Genesis. They've been doing it for 20 years. Their clinic has evolved with the genetics technology, so it's fantastic. And the physicians oftentimes will order what they call biomarker genetic testing, and that actually dictates what treatment the patient gets. So it's come so far along in the last few years that genetic testing is used to determine treatment. So it's imperative that people look into that. And you know, a lot of times people think it's really expensive and their insurance isn't going to cover it, and that's just not always true. So people should definitely say yes to genetic testing.
Good to hear. Good to hear. Yes. Beyond treatment, though, talk to us about what other resources or support systems your clinic offers. You talked a little bit about the nurse navigator, but what else?
So Genesis, MercyOne Genesis, we are COC accredited, which is the Commission on Cancer. We're the only facility in the Quad Cities in this area who does have that cancer accreditation. And what that does, how I think that separates us, is it requires a lot of really strict quality measures on how we provide care. And it's multidisciplinary, which means when you're diagnosed with cancer, it's not just oncology that you're seeing. You're getting PET scans and imaging team. The pathology team is looking at your tumor after your surgery. Your surgeons are performing the surgery. You know, it just, the list goes on and on. Physical therapy. I mean, there's many areas that are involved with the cancer diagnosis. And what's great with that accreditation is we're held accountable for good quality metrics for all of our patients in all of those different areas. So it's a specialized level of care that allows us to take care of the patient all the way around, not just the cancer.
Yeah, yeah. What kind of impact do you see your cancer clinic having and shaping the future of cancer care right here in our community?
So I think it's an exciting time. You know, we all know how terrible the cancer numbers are, and it's something that I think, while we don't necessarily know how we can control it maybe in the community yet, we're relying on the state to tell us how to do that and why the numbers are the way they are. What we can do is focus on what we're going to do and how we're going to do it to combat those numbers. So I think we're at a time right now where we're evolving as a cancer clinic. We do new bite therapy treatments here, which is treatments for people who have relapsed from different cancers, lung cancer being one of them, where a patient used to in this area, if they did relapse, a lot of times they would go to a different facility and get this, you know, bite therapy. They can do that right here now. So I think it's constantly evolving with the new treatments, getting new physicians in who want to do those new treatments, and just staying competitive for our community, because our community deserves that.
Definitely, definitely. Tara, thanks for taking the time to talk to us today.
Thank you.
All right, this was your MercyOne Genesis Medical Moments, and for more information, go to ourquadcities.com and click on the medical tab.